The nervous system is broken into two parts, the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and the spinal cord. The peripheral nervous system is made up of the rest of the nerves in the body. Both these systems are composed of nerve tissue, and this nerve tissue is in the form of two types of cells, neurons and glial cells. Neurons are the cells that allow parts of the nervous system to communicate with each other and other systems in the body. The structure of neurons are crucial to the function of the nervous system. The nervous system is composed of a series of action potentials that travels through the axon of the neuron. Myelin are glial cells that form to help the action potentials travel faster down the axon. Once the action potential has gone down the axon and reaches the axon terminal, it triggers the release of calcium into the presynaptic area. This calcium will cause synaptic terminals to then release neurotransmitters, which will exit through the synapse and be taken up by the dendrites of the next neuron, continuing this action potential through the nervous system. Glial cells are the cells that support the neurons and ensure that they are able to function in a healthy environment. The functions of the nervous system can be put into three different categories. Sensation, which is receiving information from the environment around us. Integration, which is able to take the stimulus received and process it in the brain. And finally, response, which is the decision of how the stimulus should be responded to.
The brain being one of the two major parts of our central nervous system, it is very crucial to the way in which we function. You could think of it as a control center or the executive in charge. The brain has many different parts that need to be able to communicate to allow us to perform all of our needed functions. We need neurotransmitters to send proper signals throughout our body in order for this to happen. Neurotransmitters are chemicals that elicit electrical signals that play vital roles in regulating our emotions, cognition, and behaviors. They will either inhibit or excite neurons. If they excite them, the neuron will continue receiving signals and increase the likelihood of an action potential to occur. Glutamate is an excitatory neurotransmitter, and when it creates an action potential, it helps us with memory storage. Inhibitory neurotransmitters will limit the activity and decrease the likelihood of action potential. For example, the inhibitory neurotransmitter GABA blocks signals and decreases neural activity, which is helpful when we need to calm down and relax. Some neurotransmitters can be either inhibitory or excitatory, depending on the receptor it binds to. Drugs alter the brain by changing the way in which neurotransmitters receive and send information. This can happen in two ways. One way is the drug will imitate the structure of the natural neurotransmitter and will latch onto the receptor. But since these are not the natural substances that occur in our body, they produce different responses. These responses disrupt the brainstem, limbic system, and the cerebral cortex. The brainstem is responsible for our life-sustaining processes such as sleeping, breathing, and heart rate. The limbic system is responsible for controlling our emotions and ability to feel happiness. The cerebral cortex is like the thinking center of our brain and handles things such as decision-making, problem-solving, and processing sensory information. When these areas are disrupted by drugs, they will cause all of these things to go out of whack. The second way that drugs alter the brain is by changing the amount of neurotransmitters by increasing or decreasing their presence. Some drugs can cause a flood of endorphins, which is our natural opiate-like neurotransmitter, which is involved in giving us rewarding feelings such as pleasure. Therefore, drugs that increases the production of endorphins will overstimulate our brain and cause that naturally good feeling to be extremely heightened. So when a person abuses drugs commonly, the brain will alter and adjust to this heightened state. It will begin to accept this heightened state as the new normal. And when the drug is not being used, the person will feel low when they are sober. And then they will crave the high to feel normal. The cycle of drug use will continuously increase the person's tolerance to the drug, causing them to need more of it to reach that heightened state. Addiction is defined by the American Society of Addiction Medicine as a disease that affects our brain's chemistry and circuitry that lead to compulsive drug seeking and using behaviors, and this is what that process looks like.
According to American Addiction Centers, ecstasy is a psychoactive drug. It acts as both a stimulant and hallucinogen by binding to serotonin transporters. Since it's a stimulant, that means that the drug speeds up the nervous system. Autonomic functions are increased, such as heart rate, body temperature, and blood pressure. Ecstasy increases energy, decreases anxiety, and increases pleasure, or feelings of pleasure. Additionally, ecstasy raises levels of serotonin, norepinephrine, and dopamine. Cocaine is an amphetamine and is also a stimulant. As a result, cocaine has similar effects to ecstasy and speeds up the nervous system and the body's autonomic functions. Cocaine also increases attention and alertness while decreasing appetite. This drug, as well as other stimulants, is highly addictive due to the way it impacts dopamine and the reward system in the body. Since these stimulants are so addictive, if people use them frequently and then don't, it can result in withdrawal symptoms. They can also lead the body to become used to the drug if someone uses them frequently, which will result in a tolerance, and then people will have to take more of the drug to feel its effects. These drugs can also lead a person's body to become dependent on the drug to function, which is called drug dependence.
Depending on the level of addiction, there are different treatment paths. In many cases, abstaining from using the substance and having a support group allows the body to cleanse itself without any pharmaceutical intervention. In other cases, medication is needed to prevent the individual from reverting back to using. There are two main types of medication, agonists and antagonists. Agonists simulate naturally occurring neurotransmitters in the brain. This lessens the effect of withdrawal on the body and reduces cravings, allowing the individual to stay clean. Antagonists bind and block receptors for neurotransmitters in the brain, which restrict the feel-good feeling of the drug, making it undesirable to the individual, reducing the risk of relapse. These medications, however, are only useful if they are taken regularly. Though these treatments do help, treatment is not the end of addiction. The brain's chemistry is permanently changed, and those suffering from it will have to deal with the urges associated with it for the rest of their lives.
According to Pew Research Center, 46% of people in the United States have a close friend or family member who has suffered from drug addiction, and this number is projected to rise in coming years. The American Society of Addiction Medicine has stated that more clinicians are needed to treat the rising number of addicts in America and help them break free of addiction. Possibly because of the lack of healthcare providers with the skills necessary to treat addiction, in 2017, only 17% of those that were diagnosed with a substance abuse disorder received treatment. Another contributing factor could be that the majority of insurance plans do not cover addiction treatment, so unfortunately, treatment is inaccessible for many. It is important to note that in addition to criminal behavioral addictions, like the use of illegal drugs, there are also non-criminal behavioral addictions to things like sugar and shopping. There are societal implications that criminal addictions have a greater sense of severity and urgency than non-criminal addictions, so there is not as much research examining the treatment and recovery for these addictions.